we're doing work within the Stockholm Environment Institute to try and look at the relationships between air pollution and health, but the main point of this is to give that knowledge as directly as possible to decision makers in parts of Africa, Asia and Latin America. And the delivery mechanism that we're using is a tool we're developing called LEAP IBC. So this tool allows you to look at emission inventories, emission scenarios, mitigation scenarios, but then links to an atmospheric model and to the WHO type of analysis of health impacts, but also climate impacts and also the impacts of ozone on crop yield. So we're trying to develop this integrated analysis, but putting it in the hands of the practitioners on the ground. So if we look at work we're doing in Ghana, for example, we're supporting the Ghana Environmental Protection Agency. They use the tool. So we provide training. They develop the emission inventories, the scenarios, the analysis of the number of premature deaths avoided by different mitigation scenarios, but also the avoided warming from Ghana's emissions. And then that feeds into the decision-making process. So talking with them, they emphasize the need for quantitative estimates of impacts and benefits. So, for example, Daniel Benefo from the Ghana EPA says, because we have, with this tool, estimates of the benefits of taking action, we can sit at the same table as the finance ministry. Unless we have the quantitative estimates, they're not interested. He said, admittedly, it's a long table, but at least sitting at the same table. And without that data, without that information, it's difficult for those people who want to take action on air pollution and climate change to get interest from other ministries who are responsible for either financing or implementing measures to reduce emissions.